join us on the 50 Shades of Pain show today, where we give you some handy tips about carpal tunnel syndrome.
Welcome to the 50 Shades of Pain show, where we empower our community by demystifying pain, both physical and emotional, to give you the tools that you need for optimal health. So, James, what's one of the most common reasons people have wrist and arthritic pain, wrist pain?
Because of our typing that we constantly do in our lives.
Yeah, what I call tech wrist, which is the constant typing and use of our hands, means that we have a higher propensity towards carpal tunnel. Now, what do most people think of carpal tunnel as?
Some sort of hand pain that makes their hand go numb.
Yeah, and most physicians would say it's because of compression of a nerve called the median nerve through the carpal canal, which is a canal that runs through our wrists. It's covered up by this thick band of fibrous tissue called retinaculum. The next layer in is your nerves, tendons, and blood vessels. And then the next layer is the carpal bones, or the cluster of pebbles that make up your wrist joint. Now, you can actually see all of those structures and figure out why somebody has numbness in their hand, because it's not always compression of that carpal nerve. So we're going to talk about 3 reasons you can get hand or wrist numbness, and they're not all related to that carpal tunnel. So what is the carpal tunnel? Well, if we take a look here, you can see in the middle of the screen, I'm going to get a better picture. Right there in the middle of the screen, that's the median nerve. It's sandwiched between a whole bunch of muscles in the upper part of the wrist. James, can you move your fingers?
Whoa!
All those muscles are contracting, but that median nerve running right through the center is running right through the center. We can look at the nerve in 2 directions. We can look at it in long direction, like right there. If you can move your fingers again, you can see how that nerve is free from the rest of the tissue around it. Those muscles are moving. We can look at it from this angle as well and see how, again, the nerve is in the center and it's freed up from all those muscles. And you've got a really pretty nerve. Now, if we follow that nerve down into the wrist, you can see how it comes up closer to the surface, and then when it gets to the carpal tunnel, it actually flattens out and it runs over all these tendons going through that carpal tunnel. Now, I can tell that those are tendons by moving the ultrasound probe, and you can see how it almost looks like the tendons are shiny, and they actually are shiny inside the body, but they're bouncing the sound waves off of this ultrasound in different ways. And I can make sure that I can tell the difference between the nerves and the tendons because of that shininess. Move your fingers again. You see how that nerve is freely moving?
Woohoo! Look at it dance.
Within that carpal tunnel. That's a nerve that doesn't really have any entrapments. But the retinaculum, or what makes up that tunnel, is this fibrous sheath right here. You can see some of those linear fibers going across there. And as we age, that can thicken and start to create a compression of that nerve within the canal, all the way to a point where that nerve can then get entrapped. So the first cause of carpal tunnel is thickening of that retinaculum, which causes a compression. The second cause is actually a swelling of that nerve. Even if that nerve was not getting irritated or entrapped by the retinaculum, if I look at that nerve in cross-section again, let's find it right there. So if I look at that nerve, I'm going to try to do this very delicately to get that nerve in cross-section. You can see how the nerve it has a certain width to that nerve. In James's case, it's about 1/4 of a centimeter across.
That's huge, by the way.
Not that big. But it's consistent. It's an even spaced nerve throughout the diameter, meaning that that nerve has no areas of swelling or edema. But if all of a sudden one area went from 1/4 of a centimeter to 1/2 centimeter, that's an area of the nerve where there's been some kind of an irritation or entrapment for long enough to where that nerve is now swollen. Now every time that nerve has to move in and out of that canal, it's going to get trapped. And people who have that kind of carpal tunnel, they'll feel like zingers every time they move their wrist, like a little jolt of pain or numbness that goes through their hand. And that's a different cause than the retinaculum. What I find to be the most common cause of carpal tunnel symptoms is that tech wrist, where because people are moving their hands all over the place, that pebble, that bag of pebbles that makes up our wrist right here, if that's in a dependent position like this, and these ligaments have gotten loose, every time you move your fingers, your gravity is working to pull those pebbles downwards, and where they're going to go is right on top of the median nerve. In those situations, at carpal tunnel release, where they come in and they cut the retinaculum that runs over here, that can actually be counterproductive. Initially, people get better because it's just released some of the tension on that nerve, but over time, that destabilizes these carpal bones even more. And so over time, those pebbles will continue to be fluxing in and out and constantly be compressing that nerve and cause irritation. That's why those carpal symptoms can wax and wane, get better and worse, is because it has to do with the positioning of those bones in your wrist. Simple maneuver would be to see a chiropractor, an osteopath, or a physical therapist who does osteopathic manipulation and put things back into place. But it's not a long-term solution. What needs to happen over the long term is some kind of rehab that stabilizes those carpal bones, or even using an orthobiologic to glue those carpal bones back into place. And with the first two reasons that people get carpal tunnel, the retinaculum thickening, you can release that by doing injections around the retinaculum, or you can reduce the swelling of that nerve by, again, doing injections around that nerve and reducing the inflammation and swelling around it. So, 3 reasons that people get carpal tunnel symptoms: retinaculum thickening, nerve swelling, or carpal bone instability. And for all of those, we've got great options here at Wellward. If you found this to be helpful, look us up on our wellwardmed.com website. We've got a podcast. We just did a little bit more in-depth about the causes of wrist pain and hand pain. It's called the Wellward Way Podcast. You can find it on iHeartMedia,
Spotify, and iTunes.
There you go. Or you can call our patient navigator at 859-275
HURT.
HURT. And we'd be happy to get you set up for the help that you deserve. James, anything I'm missing?
That's it for today. So I'm Dr. Escaloni.
And I'm Dr. Donish, and if you found that to be handy,